Hi, my name is Zhuo Chen. My Europe with the Food Science and Nutrition Department is Total Mineral Analysis with Microwave Plasma Atomic Emission Spectrometry (MP-AES) in cricket powder for chronic kidney disease (CKD) dietary management. I'm glad that I could work with so many passionate people to explore alternative protein source for the future. First, why insects or entomophagy? The growing global demand for sustainable and nutritious protein-rich food sources has led to the exploration of insects as food source, in our case, the cricket powder. We chose cricket powder product from a prosperous local cricket farm, 3 cricketers. For patients with chronic kidney disease (CKD), managing dietary minerals is critical, as excessive or insufficient mineral intake can cause severe health complications. As a novel food choice, cricket powder lacks consensus mineral content information at the time. So, what do we know about CKD and minerals? Eating less sodium helps lower blood pressure and may slow down CKD progression. One of the kidney's important jobs is to filter sodium out of the body and into the urine. Damaged kidney cannot filter as well as healthy kidneys can. This can cause sodium to stay in your body and make your blood pressure go up. In some people with CKD, the kidneys may not remove extra potassium from the blood. Some medicines also can raise your potassium level. When you have CKD, phosphorus can build up in your blood, making your bones thin, weak, and more likely to break. It can cause itchy skins and bones and joint pain. Most people with CKD need to eat foods with less phosphorus than they usually eat. A moderate target for dietary calcium intake should be recommended in CKD around 800 to 1000 milligrams per day, which is close to the recommended daily allowance RDA of 1000 to 1200 milligrams a day, varying by age for healthy adults. Iron deficiencies is also prevalent in patients with CKDs and should be treated. Inconsistent and inadequate absorption of oral iron frequently leads to the need for administration of intravenous iron. Recent evidence also suggests that increases in both serum and intracellular magnesium can slow or even prevent the development of vascular calcification seen in CKD patients. Serum zinc levels tend to be low in chronic kidney disease patients. In addition, reaching and maintaining a proper serum zinc level could represent a valuable target to reduce symptoms and contrast the progression of kidney impairment in patients with a high risk of developing CKD. Although it's generally advised that CKD patients should monitor and limit their protein intake during different stages, they still need to consume high quality protein. High quality protein food is also a source of minerals previously discussed. It is also believed that plant protein is a better source of protein than animal protein for CKD patients, with one of the reasons potentially being its different mineral profile from animal protein. However, plant protein also lacks some crucial and beneficial minerals like iron and zinc, especially in their bioaccessible forms. Insects have different nutrition profiles from traditional animal and plant protein, therefore, by examining the mineral profiles of insect products, we might be able to find an alternative protein source with better mineral content balance for CKD patients. In this experiment, 100% Angus beef patties and tofu were selected due to their minimal processing and commonly dietary use. All 3 products went through a muffle furnace to retrieve ash. After diluted with nitric acid to proper concentration, the samples were examined by MP-AES to determine their total mineral content. So the mineral analysis results come back to show that cricket powder appears to be the highest in sodium, potassium, phosphorus compared to the other 2 groups. It also appears to be higher or on par in calcium, iron, magnesium, zinc. comparing to the other two groups. The mineral analysis results indicate that cricket powder has an overall rich mineral profile with the potential to have a better balance than traditional protein sources. Further research in a few related areas are worth pursuing, including food safety, mineral bioaccessibility, cost for low-income patients, and acceptable ways to incorporate it in diet. I will be mainly focusing and following the second one because plant protein superiority over animal protein for CKD patients can be attributed to the lower bioaccessibility of certain minerals. It means that although it may have higher mineral content, less amount is actually absorbed into human body. Therefore, it is necessary to carry out future examinations, including in vitro digestion studies, to find out the amount of accessibility minerals from cricket powder. Thank you.